Hi, I'm Dr. Rob Cushman, the Medical Officer of Health for the Renfrew County and District Health Unit. Today I've got some great news, but I have a very important personal request for all of the citizens and the residents of Renfrew County. First of all, the good news is that the province and the federal government have announced that we're now going to get a very significant added supply of vaccines in the weeks and months to come. And this is great news because as of the end of this week, we will have vaccinated almost 40% of our residents, and for the first time. And as you know, we have to cycle back and do the second vaccine starting probably around early to mid-June. And there were some concerns about the supply of vaccine. But now we're confident that the vaccines are starting to flow and our clinics will be expanding. So this is great news. But in the meantime, I have a very important request. You have to be patient and you have to be courteous. We've seen some really bad actors out there, despicable behavior. We've seen people coming in, masquerading for another group. We saw someone in a clinic yesterday, a drive-through clinic, that was angry, managed to splash everybody driving their vehicle through the parking lot. We've seen someone coming in claiming to be morbidly obese, and we're health professionals. We know who these people are. We've been around the block. We're very seasoned. This person was not morbidly obese. They probably couldn't get into the bathing suit they were wearing 2 summers ago, but certainly they didn't qualify for being in that risk group. We've seen this time and time again. People falsifying letters, people doing multiple bookings. So please, please, be courteous and be patient, and your time will come. And stick to the public health measures, which are all important and will continue to be so in the next 2 months. Now, we have over 1,200 people who could not register with the internet for some reason or another, lack of access or lack of skills. And these are older people and high-risk people. And we are actually telephoning them as I speak and over the weekend to ensure that they get a spot. So they actually will be bumping some other people in the next 2 to 3 weeks. But this is so important because this is catch up for these people who are at high risk and have high needs. And again, it gets back to what I was saying. You have to be courteous and you have to be civil. We don't want to see some of the behaviors that we've been seeing. I would also add that if you booked at maybe 3 clinics and you've decided which one you want to go on the clinic for the one you're choosing not to go to, and there is a spot on the internet, on the email, where you can cancel your appointment. Because we have people now who have 2 or 3 appointments, they don't show up, and this creates problems. First of all, it means someone else can't be vaccinated. Secondly, as you know, with these vaccines, it's very crucial that we get the doses into arms. They don't do well at room temperature. So this is important. We don't want to waste vaccines, and we want to make sure that everyone who needs a vaccine has one. And I'll just come back to my final point, that this is great news. It's coming, but we have to be patient. And as for the bad actors, I'm serious. Let me tell you, we have something called a Section 22. We can fine people for poor behavior. And also, if you want the police knocking on your door, just try us. We've seen, as I said, we've seen some 50 people who've really been very abusive of our staff, trying to jump the queue, and your time's up. And I've told people that our people know what to look for. They're very seasoned in terms of what health issues are, what the priority groups are, and also having worked in the health sector, they've seen abuse before. They recognize it quickly and they won't stand for it. And let me tell you, you challenge us, watch out, because we'll be on you. If you want a humiliating experience, if you want to spend some time with the police, just try us. And I've instructed staff to do that very thing. Just to conclude, I want to thank everybody. Vaccines are coming, to be patient and continue. We must continue to get through wave 3 and the variants, to exercise the public health precautions, the masking, the distancing, the hand washing, but most of all, to keep your group very, very small, to stay within your household, and to be very careful at work not to let down your guard. So again, thank you very much. The good news is the vaccines are coming, and I'm very confident by the middle of June, we will have most of the population vaccinated, and we will be moving into second doses. And this is great news. Thank you.